Hello students, today we are going to have class on birth asphyxia in newborn. Birth asphyxia ये term आप लोग के लिए बहुत ही familiar है. Okay, I think in the last few classes also we discussed about this term, right? So what is asphyxia? It means lack of oxygen and blood flow to the brain. Okay. Asphyxia means lack of oxygen and blood flow to the brain, and it can be even fatal. Okay. So it is something that occurs soon after birth. That's why we term it as birth asphyxia in newborn. Okay. Birth asphyxia you can define as a condition that occurs when a baby doesn't get enough oxygen during the birth process. It can be fatal. Another more common term for it is perinatal asphyxia, or we call it as asphyxia neonatorum, right? So that's the other term we use for birth asphyxia, perinatal asphyxia or asphyxia neonatorum, right? So what happened when a baby brain or organs do not get enough oxygen and nutrients before, during or right after birth? Okay, so without oxygen and nutrient, the cells cannot work properly and the waste products build up in the cell and it causes the damage. So that's what actually happening in birth asphyxia. So it is nothing, it means lack of oxygen and blood flow to the brain. Okay, then we'll be seeing the causes of birth asphyxia. Umbilical cord problem such as knuckle cord, that is cord wrapped around the baby's neck. Okay, then umbilical cord prolapse can cause birth asphyxia, short umbilical cord or cord in a true knot. Okay, these are the common causes. Along with that, ruptured uterus. Ruptured uterus occurs because of intense contraction, right? Due to certain drugs. Okay, so that can result in birth asphyxia. Preeclampsia, eclampsia, you already know, increased blood pressure. Placental abruption and placenta previa, that is the separation of placenta before birth, right? And anesthesia mistakes, that also causes birth asphyxia. What happens? Anesthesia mistake causes blood pressure problems in the mother, including hypotensive crisis. Okay, and once hypotension occur in mother, this can greatly decrease the supply of oxygen rich blood going to the baby. Okay, so ultimately these all problems affect birth asphyxia. Okay, if you find that any of the case is there or any of the history is there with the baby, you have to assess for this asphyxia. Along with that, oligohydramnia, that is the low amniotic fluid, is also a cause for birth asphyxia. Premature rupture of the membrane, I think recently you discussed about this topic. Prolonged and arrested labor, intracranial hemorrhage. Intracranial hemorrhage we discussed in the birth injury, right? It is usually caused by traumatic delivery, by use of forceps and vacuum extractors, right? Then sometimes intense contraction caused by labor induction drugs like pitocin and cytotec can also cause the intracranial hemorrhage. Then certain mismanagement of CPD, cephalopelvic disproportion, breech shoulder dystocia can also result in hemorrhage, right? And sometimes hyperstimulation that leads to ruptured uterus. It is also caused by the pitocin and cytotec drug. Then certain fetal stroke, okay, that can reduce the blood supply to the brain. And post maturity syndrome like macrosomia or oligohydramnias also can result in birth asphyxia. So these are the common causes that can result in birth asphyxia. Along with that, we can say one unknown cause. Okay, in many conditions we don't know why the child is having birth asphyxia. Okay, then we'll be seeing the types of asphyxia. Basically, there are 3 types of asphyxia based on the score of Apgar. Apgar score we recently discussed, right? So, mild asphyxia, Apgar score 6 to 7, which requires only tactile stimulation for initiating breathing. Okay, medium asphyxia where Apgar score is 4 to 5, which requires bag and mask ventilation with 100% oxygen to initiate breathing. Right, and the third type is the severe asphyxia where Apgar score is from 0 to 3, which require bag and mask ventilation and compression including medication. Right, the common the normal value of Apgar score you already know, it's 8 to 10. So if any score is getting less than 8, then you say that condition as asphyxia, and less than 3 is the severe asphyxia case. These are the common signs of asphyxia. It's very simple: hypercarbia, high carbon dioxide level in the blood; hypoxia, insufficient oxygen, right? Then ischemia, insufficient blood flow to the brain, which disrupt the metabolic pathways. Then acidosis, it's a increased level of acid in the blood which decreases the heart function. Decreased heart function causes hypotension and insufficient blood flow to the brain. Then waste removal disruption, as I told you that because of lack of oxygen and nutrient, the cell cannot work properly. Waste products build up in the cell and that also causes the damage. So that are the common signs of asphyxia. Next, we will be discussing the symptoms of asphyxia. Not breathing or very weak breathing is seen in the newborn. Skin color that is bluish, gray or lighter than normal. Low heart rate, poor muscle tone, weak reflexes, too much acid in the blood, then meconium fluid stained with amniotic fluid stained with mucinium, and seizure. Okay, meconium is the first stool passed by the newborn baby, right? But because of distress, sometimes the baby passes the meconium in the womb itself. That's why we say that condition as amniotic fluid stain, meconium stained amniotic fluid. Okay. Then are the stages of asphyxia. Basically, there are 2 stages of injury that you can see in asphyxia. First stage happens within minute if blood flow is low and cell do not get enough oxygen. Okay, so that's the first stage, and second stage we call as reperfusion injury. It may last for days or even weeks, and this injury happens after the brain starts getting normal level of blood and oxygen. And why this injury happens? Because of the toxin released or the waste released from the damaged cell. So we can say that stage 1 is primary apnea, okay, which can be easily resolved, and stage 2 is secondary apnea, which need some intervention, right? Next are the diagnostic tests that we do. You will find acidosis condition. So severe acid level, that is pH less than 7, you will find in the arterial blood of the umbilical cord. Then Apgar score 0 to 3 will be there for longer than 5 minutes in case of severe asphyxia. Along with that, respiratory distress, low blood pressure and other signs of low blood flow to the kidney and intestine you can easily see. Okay, so basically we diagnose birth asphyxia on the basis of Apgar scoring, right? And the other thing that you can do is the resuscitation algorithm. Initial steps of resuscitation, clear of meconium, breathing or crying, good muscle tone, right? This I taught you. So on the basis of that you can easily recognize this birth asphyxia. Management, the treatment include giving the mother extra oxygen before delivery. If you find any of the causes that we discussed earlier in the mother, you can start giving extra oxygen before delivery itself. You can plan for a cesarean section, right? Then emergency delivery can be conducted if you find that the baby is under distress. Then assisted ventilation and medication to support the baby's breathing and blood pressure. And ECMO we give, that is extracorporeal membrane oxygenation. Okay, this we can give. Extracorporeal means you are giving everything outside the body. Okay, this is a machine which does the work of baby's heart and lung. So this you can give so that the baby can have normal survival. That's the management. Next is the complication. You can see all the complication is because of brain ischemia. Okay, permanent brain damage, seizure, cerebral palsy, intellectual disabilities, developmental delay, motor disorder, microcephaly, and the last periventricular leukomalacia. This we already discussed in birth injury, right? So all this complication is because of asphyxia, and the most common will be HIE. I think you know HIE. This also we discussed in birth injury, that is hypoxic ischemic encephalopathy, may be a result of severe asphyxia. Okay, now how to prevent this? Closely monitoring the mother and the baby so that fetal distress or impending distress is recognized. Okay, that is very important. You have to monitor both mother and baby very closely. Okay, so that early detection can give good intervention, and you can revive the life of the baby. Okay, then quickly delivering the baby when fetal distress or impending distress are present. Okay, as we discussed in the management, emergency delivery, or you can plan for a cesarean section in order to take out the baby from the distress. So okay, so that's all about birth asphyxia. Okay, already you were having some idea about the term asphyxia. I think today you got some more knowledge on this. Birth asphyxia is a condition which is an indication for neonatal resuscitation, right? We discussed neonatal resuscitation. Okay, so in case of birth asphyxia, if you are closely monitoring the baby, and if you are able to recognize birth asphyxia, and if you are able to resolve it through resuscitation, then surely the baby can survive. Okay, and here we discussed about the types of asphyxia. There also with each type I have mentioned the intervention that you need to do, right? And the stages of birth asphyxia that we have discussed, you should never allow the baby to enter into the second stage. Okay, if you are able to give the resuscitation in the first stage itself, definitely the baby will come or will revive to the normal life. Okay, so that's the precaution, or that's the concern you need to know. That's all. I hope you understood the topic. Thank you.